and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. On today's episode, we're going to be talking about one of the hottest topics in healthcare, and that is generative AI and AI in general, and how it's being deployed in healthcare. Joining me today on the program are two gentlemen from CareCloud. We have Hadi Chaudhry, the CEO of CareCloud, and we also have Adeel Sarwar. Welcome to the program.
Thank you for having us today. Thank you.
Thank you. Thank you for having us on the show.
Now, just in case some of our audience aren't familiar with CareCloud, can you both kind of give us a quick introduction of the company and to some of the work that you're doing there?
Sure. So as he mentioned, I'm the CEO and president of CareCloud. Hadi Chaudhry is my name. So CareCloud is a publicly traded company. We provide tech-enabled revenue cycle management services to the healthcare providers in the United States. We do also have the full suite of proprietary solutions, which is EHR, practice management, patient engagement solution, business intelligence solutions, remote patient monitoring, preventive care, different tools that can support the preventive care and the value-based care models. And then recently started focusing towards creating the products which can support the same industry, leveraging the generative AI technology. It's not a new thing for us. We have been creating the products or leveraging using the conventional AI for decades, but now with the introduction of the generative AI, so we kind of started focusing more towards the generative AI as well.
And Adeel, what's your role at CareCloud?
So I serve at CareCloud as Chief Technology Officer. I'm with the organization for like last 15 plus years. And in my role, I work with product teams, engineering teams, different stakeholders. I closely work with our clinics and the providers, getting their feedback, what they want to implement, getting those implemented in our products, and then rolling those out.
So let's dive into the topic at hand. No hotter topic in healthcare at the moment than AI. How is CareCloud approaching AI and its use in healthcare?
Yeah, great question. And just to give you, first of all, a little background, we were founded in 1999. We started as a RCM company or as a medical billing company. Quickly transformed into a healthcare technology company by launching our first proprietary software or solutions of EHR and practice management. So if you think about it, so we have been working in this space for over 20 plus years now, close to 25 years. And we are serving about 40,000 plus providers and in all 50 states of the United States. So if you think about it, today we have the clinical and financial data of the last 25 years for medical providers of different specialties, different genders, different payer from the financial and the reimbursement models. So what we think was this diversification, this data can really help us train the AI models and can help clinically and financially to our practices. How can we support their business needs? How can we improve the clinical workflows? How we can improve that they can better serve their patient, they better can treat their patient, and at the same time keeping an eye, because at the end of the day, that's the business of healthcare for them. They need to be profitable as well. So we are trying to provide, with leveraging the generative AI technology, the best of the both worlds, leveraging the last 20 plus years of the data.
So let's talk specifically about generative AI, which is sort of a very niche area of AI. You talked more right there about general AI and its use in clinical as well as financial practice, but generative AI is the one that's getting a lot of attention, both good and bad. Right? How do you see healthcare as an industry using and leveraging generative AI?
Right. And maybe we can just talk about a little bit, and I'll have Adeel talk about a little bit about the two products that we have recently launched. Okay. It's in the very initial stages. It's similar to many other healthcare companies who are bringing in the first set of the generative AI, the tools and the products. So one is where we are trying to, once the patient walks into the office, so leveraging their existing data such as their social history, family history, their current medication, the existing lab results, and at the time of the check-in, when the patient mentioned that this is the existing symptoms, so we can suggest, and again, the doctor will still be in the driving seat, But as a co-pilot, we can, or as a second opinion, our system recommends and suggests, okay, these are the 5 tests you can conduct on this patient, or this could be the potential next medication you can prescribe to the patient. So that's what we are trying. So that's one thing, and the second thing is where, like we are talking as a doctor and the patient conversation, the system can keep listening, and with the help of the generative AI, can take the noise out and can convert that into a chart note, which ultimately can be converted into a discrete data fields as well. But Adeel can talk about a little more details.
Sure, definitely. Thank you. And then our philosophy at CareCloud is we don't look at all of these frameworks and generative AI just for the sake of developing some solutions for those. We try to look at the real world problems, what doctors and patients want from the healthcare industry. I would like to give a couple of examples here. So for example, if you go back in 2010, when everyone was kind of doing all of that charting manual, doctors and patients, they had a better face-to-face time. With all of these EHR in the clinics now, the number one complaint from the patients is we don't have direct face-to-face time with the doctor. Doctors are all the time busy in charting, and they have to do that. So the first objective was how we can use generative AI or AI to increase the face-to-face time between the doctors and patients, where they can actually coordinate with each other, interact with each other, and AI can take care of all of the clinical documentation for that. And this is where Hadi, like mentioned, the product that we have just showcased at HIMSS, Cirrus AI Notes, where it is listening to the doctor and patient conversation in the exam room. Doctor and patient can talk to each other, and this generative AI is taking care of all of the clinical documentation portion per the compliance requirements. And then number 2, again, the problem statement, doctor is there in the exam room, they don't have anyone else in their decision-making process, and they're relying on their medical knowledge and their experience to come up with the best decision for that patient. So we wanted to provide a clinical digital assistant in the exam room for the doctor, so that once the doctor is done with all of the clinical documentation, these are the problems, these are the medications, then there is someone in the form of the AI digital assistant who can guide the doctor. Hey doc, we believe these could be the possible problems, or these could be the possible medication. And this is where we came up with the CareCloud Cirrus guide. So these are 2 of the areas that we are focused at this time.
So Adeel, it sounds like some of the benefits that you're mentioning there of generative AI, more face time with the patient, better patient experience, but also some efficiency gains.
100%.
Are those kinds of the benefits that you're
100%.
seeing for generative AI?
If you see that, okay, if you talk to any of the doctors, they would share with you that at least 20 to 25% of their everyday time is in the administrative workflows. For example, if doctor and patient are talking about with each other in the exam room for 4 or 5 minutes, doctor is spending additional 7 to 8 minutes in the clinical documentation. And this is where generative AI and our product, it is going to cut that time, so that all of these 7 or 8 minutes may be saved, and then administrative burden may be reduced on the doctors. We know that doctors love medicine, they love to practice, but they don't want to document all of that. And this is what we are here, and the generative AI is here to take care of all of that.
And again, this is we are just trying to focus on one segment, which is the practices, the small to medium or large practices, doctor to patient interaction. But in the bigger picture, the generative AI is absolutely helping, and will keep on helping, and going to improve on the clinical trial, the complex diagnosis, if you look at it, the X-ray images, and can parse through thousands of images, and can quickly looking at it, and in the rare diseases cases as an example. So there are too many of the variables that a doctor needs to look at to come up with, okay, this could be one possible rare disease. And with the help of the generative AI, many of those things will become a lot more easier than ever before.
And as we look at AI, and we look at implementing it in healthcare, what challenges do you foresee that we are going to encounter in healthcare adopting AI more ingrained in the solutions?
Right. That's an interesting question. So There are challenges on the solution provider side for many vendors like us, and then there are challenges on the other side of the table, which are the provider or the end user.
Okay.
So for vendors, so in any AI, the first and the biggest challenge is the AI model, the data on which the AI model has been trained. And the reason it becomes way more significant in terms of the healthcare, because you're dealing with the lives of the patients. If the recommendations that you're getting are not good enough because the data on which the AI has been trained on is not the representative data or not enough data, your answers could be wrong.
To be correct.
And the second point is the biggest challenge is since the healthcare is the highly regulated industry, so you need to be mindful of whether it's the HIPAA laws, the PHI, and a lot of those things needs to be considered and taken into account before you're able to train the models. There are many vendors, whether it's Google solutions or Microsoft solution or ChatGPTs, all of them are great. But again, if you think about healthcare, how much data that they are using to train the model, access of which they have provided to the model is the representative data. If you think about us, we are working with 40,000 providers for the last 20 plus years, small to 1 to 5 doc ambulatory practices. Google or Microsoft or any of these players so far didn't have enough access to that level of data. The data that they're using are the secondary in nature or through the health system space. But the health system space, in many cases, the data may not be representative enough for their AI model to be trained on. So I think that's one challenge. It will keep on improving. The results will keep on improving over time. So that's one. And the second thing, we look at it as from the compliance and regulatory perspective. For the end user, is it cost feasible for them to adapt to a AI-based product? It's much more becoming irrelevant today compared to what it was, let's say, 2 years before or 5 years before. So those are the way I think we are looking at some of the challenges.
Let me ask you, maybe we'll start with Adeel on this one. As you look at the industry, you just heard about the challenges. How can companies and organizations get together and collaborate to overcome some of these challenges to implementing AI in healthcare?
Great question. So I believe healthcare industry has always been facing those challenges where everyone is working in different silos, and there is lack of cooperation and coordination between all of the healthcare industry players. And we have started seeing all of this with the generative AI and the large language models as well. I believe transparency and more coordination needs to happen here, where, for example, the larger players, as they are developing and working on their LLMs, if they may share the proper documentation, how they are training those LLMs, so that whoever is going to use them or is going to fine-tune them, they would exactly know what they can achieve out of all of that. To Hadi's point, for example, when we talk about these LLMs and the data on which it has been trained, the biasness of that data, that's a very critical point. So again, documentation of all of those LLMs, how they can be used, reused, and fine-tuned. Any documentation, any cooperation on that would be appreciated in the industry.
I think that interoperability context, because if you think about even at the HIMSS show, the key topics continue to be, other than generative AI, one is interoperability, another one is cybersecurity. So that interoperability will, if that can also exist in this generative AI, the AI models, between the different companies can share that and understand the different trained AI models can help overall the entire health industry.
So as you look at the industry as a whole, where do you think the future trend is going to be when it comes to generative AI in healthcare?
Right. So I think one is the government initiative have been for the last 20 plus years, the preventive care models, the value-based care model. Instead of a fee for service, it should become the responsibility of the provider, the well-being of the patient, not looking at every single transaction, how you can improve the well-being, the health of a patient. And that's where the generative AI can really put this thing on a fast track. Because before that, everyone was trying to come up, okay, I can have this 5 devices that I can put and install on the patient, and then can receive the data, and then you need to write another application to how to understand data and then fire the right triggers. So I think all those things is with the help of the AI, it's just going to put all that on the fast track. I think that's probably is the end goal, and which can improve the overall healthcare.
Well, Hadi, Adeel, you've shared a lot of great information with us today. Where can people go to find more information about CareCloud?
The best place will be the website, www.carecloud.com, and there will be an email or a phone call or a message away.
Amazing. Well, thank you to both of you for being on the program today. It's been great having you.
Likewise. Thank you once again for having us.
And hey, if you liked this interview as much as I did, please like and subscribe. Also, head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.